Ramadan Kareem, and welcome to another episode of your show Medical Talk. I'm Dr. Mohammed Al-Mahtab. Now, during Ramadan, many concerns and questions could be asked by patients with different health issues. A common health condition lays within cardiovascular diseases. Changes in eating, drinking, and sleeping patterns can impact how the heart works. It's crucial for people with heart issues to talk to their doctors before fasting. They might need to change their medications or adjust their eating habits. Learning about how to stay healthy during Ramadan, like eating the right food and watching for signs of troubles, can help keep hearts safe while fasting. It's all about taking care of your heart while still following religious traditions during Ramadan. To know more about the topic of this episode, cardiology, issues and concerns during the holy month of Ramadan, we are pleased to host Dr. Abdurrahman Braden, Senior Specialist Cardiologist, to answer some of these questions, but right after this break. Welcome back. We're happy to have with us in the studio Dr. Abdurrahman Braden, Senior Specialist Cardiologist. Dr. Abdurrahman, welcome to Medical Talk.
Nice to meet you, Dr. Muhammad.
And happy Ramadan.
Happy Ramadan to all.
Thank you so much. This is a very interesting month, and it's with a very interesting topic, of course, and we are happy to have you with us.
Thank you.
If we can just, at the beginning, you can tell us about the common cardiovascular issues that you see in our community.
Yeah. Really, we see a lot of patients suffering from cardiovascular issues, simply hypertension, diabetes, and dyslipidemia. This is all lead to cardiovascular issues, leading to ischemic heart disease. It's mean a narrowing of the blood vessels, stroke, heart failure, arrhythmia. This is the most common cardiovascular diseases in our community, especially the valvular heart disease, especially in the old age, because this is a process of calcification in their cardiac valves.
Exactly.
Yeah.
Now, in your opinion, what are the reasons for the increase of the cases of cardiovascular disease in this community?
Yeah, the number of the patient really increase in Kuwait because sedentary life, people here not exercising well, our eating habit, especially in Ramadan, and also lack of interest for follow-up and close monitoring of the patient not coming well. Also, one of the most risk factors is longevity. MashaAllah, alhamdulillah, people here living, alhamdulillah, they have a good age, so they suffer from the cardiovascular risk factor because of this all factor contributing to their medical condition.
Exactly. And as you mentioned, it's the lifestyle, and basically patients are not following up with the cardiologist whenever they have a serious condition. Now, this leads me to my next question, which is how important it is for the patient to follow up, because as you know, this type of disease or conditions, they require an extensive follow-up. It's not just one visit to the polyclinic.
Sure. Yeah. Patient in the beginning, almost I'm seeing our patient when they are get issue in heart, they are know that they have cardiac problem, become panic at the start and close monitoring, and they are keen. After some time, they become denial.
Basically.
Yes, it's a very problem. I remember one case, they have a chest pain, and one of colleague called me, my father has a chest pain. I told them, go to the hospital. No, it's go to the hospital, make an ECG. And this is a ABC, make an ECG. He told he's a carry heavy object, and maybe this is from muscle spasm. I insisted to go to the hospital and he denied. Second day he did ECG and he has extensive myocardial infarction. It means he lost myocardial function and muscle, and unfortunately he is
too late.
collapsed and he get a cardiogenic shock. We cannot help him. After a few days he died.
No.
If he went from the first time to cardiologist or ER for any hospital,
He would have a better
he will,
chance.
yes,
Yeah.
completely different.
Yeah.
He will take a good remedy. He go for cath lab. He fix stents. His life changed a lot.
So,
Yeah, you know our myocardial muscle, if having blockage, it's a matter of time. 6 hours and the muscle will die. Yeah, always I'm telling my patient, valves could be changed, blood vessel could be changed, electricity could be changed of the heart, muscle could not be changed.
Exactly.
Who will give you his heart?
Exactly.
Cardiac transplantation is not available in Kuwait.
And even with that, you
Yeah.
know, it's not, the success rate might not be 100%. And,
Yes.
you know, and you might not be a good candidate for it.
Is-
But I want to ask you about the fasting specifically
Yeah.
during Ramadan. It's, you know, for some patients, especially with cardiovascular disease, you mentioned it's an array of issues. It's not just the heart. It just could be, as you mentioned, high blood pressure, diabetes, that could affect the cardiac output. Basically, fasting might, I assume, be challenging for some patients, not all of them, but from your opinion, from your expert's opinion, how does fasting play a factor?
Yeah, really fasting is very good for the heart.
It is good for
Yes, fasting is very good for people. In one study in nutritional journal, they studied around 80 person fasting 10 hours for Holy Ramadan. They make check blood pressure, body weight, labs, glucose. Everything is become very good after fasting for at least 10 years, so reduce the risk of cardiovascular risk factor for cardiac ischemic heart disease for that patient. So we encourage people to fast. Intermittent fasting is very important for the health of the person, especially if the patient has single risk factor, some diabetes, some hypertension, and he is able. We encourage patient for intermittent fasting. Also, we telling the patient, please go for some diet changes, lose some body weight. And Ramadan, if they are eating healthy food,
If
yes, yes,
yes,
you know
exactly.
our
Yeah,
Arabian
exactly.
habits
Yeah.
in Ramadan.
Exactly.
Yeah,
But I'm saying, like, if somebody who's been diagnosed with a certain cardiovascular issue, which maybe will require some medications, some certain lifestyle, basically, are they allowed to fast, or is there like a guideline for those patients on how to manage fasting properly?
yeah. As regard cardio patient, they have ischemic heart disease or cardiac issue, we classify the patient into 4 groups: low risk, intermediate risk. Like some patients, they have stable coronary artery disease, compensated heart failure, treatable arrhythmia, high risk or very high risk, like patient have recent myocardial infarction, it's mean a blockage of coronary, or decompensated heart failure, patient unable to breathe, lower limb edema, and they cannot sleep well, lie down. So according to the guidelines, low and intermediate risk could be safely fast if they are close monitoring their medication and following with their doctors before Ramadan. It's always we advise a patient to come before Ramadan to review, to adjust, to give instruction. And on the other side, in high risk and very high risk, unfortunately they are not allowed to fast because it may affect their health.
Exactly. Well, we're going to talk more about the cardiovascular issues and Ramadan, but we have to take a short break, and we'll be right back. Stay with us.
Thank you.
Welcome back. We're still talking in the studio to Dr. Abdurrahman Braidan. Dr. Abdurrahman, before the break, we were talking about Ramadan and fasting and people with cardiovascular issues. And you mentioned that they are classified into 4 categories.
Yes.
The top 2 categories, which is very severe and high risk, they are not advised to do fasting due to certain condition or certain medication.
Yes, medical problem.
I think it's very important that we explain to our viewers why it's important for those 2 category patients, to follow the instruction of their cardiologist.
Yes.
And not to fast, because if they do fast, because as you know, some people may consider fasting as a priority.
Yes.
But what could happen if they don't listen or follow?
Yeah, unfortunately, they may lose their life or quality of life. They may be hospitalized, compromised, or maybe unfortunately will suffer or die. So I am not advising the patient with high risk to be fast, because Allah give us some circumstances to avoid. We are treating patient, and Allah is giving them chance to become non-fasting.
Exactly.
Yeah. And they will give also thawab.
Yes, exactly.
They are not forced to be fasting. I am giving advice to my patient with high risk. If the doctor told them, don't fast, please listen to your doctors, and it will be good for you and good chance for you for to maintain your healthy life.
Exactly. And I think it all comes down to adjustment that the patient needs to make in their day-to-day life during the month of Ramadan. Some of the adjustment that could be made for some patients who might allow to fast. What are some of the adjustment that you might recommend?
Yeah, first of all, before Ramadan, we need to see the patient, go to his cardiologist to review his medication, do some labs as a baseline, because Ramadan, it will be fasting at least 12 hours. There is incidence of dehydration. It will affect his kidney function. Medication, if he's taking 3 times medication, could be changed to sustained release. And we have a lot of forms and timing of the medication to be also reviewed. And those adjustments to decrease some doses, increase some doses, close monitorings of electrolytes, especially because of patient of heart failure is receiving diuretics, and the issues they are taking early morning and they are fasting. So it should be reviewed with his doctors to give a proper dose and a proper concentration for the medication.
Because it's important that our viewers understand that with dehydration, the kidney function could be affected. And a lot of people, they don't know that actually the kidney function is actually linked to the lung and the heart.
Yeah, we have a syndrome, is cardiorenal syndrome. Once the heart is affected, kidney also affected. When the kidney is affected, heart is affected.
It's like a circle.
Yes.
Yeah.
Again, it's a matter of adjustment of medication. Some precautions. Patient is taking non-fasting hours, plenty amount of foods. During suhoor, he will take some plenty food with containing water, like vegetables, watermelon. So also diuretics, we decrease the doses of the diuretics to avoid this dehydration.
Exactly. So we have to work with the patient on a plan that it will fit or suit their condition, basically.
It's a cooperation between doctor and patient. And patient, to be honest, tell the doctors what he will do, frankly, and doctor will give him advice. So we can pass Ramadan smoothly, inshallah.
So since we are in Ramadan, let's talk food. Okay, I think it's very important that we explain to our viewers what's basically, in your opinion, as a cardiologist, what is a good dietary plan that they should have?
Yeah.
To maintain a good heart.
Yes,
basically.
Alhamdulillah, Ramadan is 1 month. If the man took this chance and eat well, he will lose weight. Ramadan give us good chance to relax the stomach, relax also the GIT and the heart. If the one consume a moderate amount of food. Like unfortunately, we are in a Arabian country, we have some bad habits, sweets, fatty foods. This is not good. By the way, we have a good chance to eat well, starting futur, we have two main meals, iftar and suhoor. Starting the iftar by 3 dates with some foods, it gives us good amount of energy, good fibers. Then drinking plenty amount of water, eating a moderate diet, high energy diet with low sweet and low salt, and not to fill his stomach. So we can manage this weight. And also during the suhoor, we can take high vegetable diets, some protein diets. It give high energy and complex carbohydrates. You know, complex carbohydrates. It take time for consumption and give energy. And I'm advising my patient, especially if there is a melon or watermelon or cucumber, tomato, increase amount of fiber. One of the most important diet for the heart we can consume during Ramadan is a Mediterranean diet. People there around the Mediterranean Sea area, they notice they are very healthy. They studied why these people is very healthy. They found them eating whole grains, low carb, low fats, and increasing amount of fruits. If we maintain this is healthy diet, especially during Ramadan or after Ramadan, they will give good health for the heart. I'm always advise my patient to eat Mediterranean diet. They can search for the internet what is the items for this Mediterranean diet, and they can consume. It's mainly low fat and high grains diet with some olive oil and fruits.
And some fish, I assume.
Yes, sure.
Like
fish.
salmon and stuff like that.
Yes, salmon. But also the way of the cooking fish, not fried fish.
Yeah, exactly. Yeah. It has to be like grilled.
Yeah,
or
and I'm advising my patient, especially for high cholesterol level, avoid any fried meal. Avoid junk meal. You know.
What about sweets and Ramadan sweets? You know,
sweets,
mostly like fried and.
If they want to lose a weight, avoid sweets. Eat little. I remember one of them, my patient, he told me he become not desire unless he's eating 1 kilo kunafa at the same time. How come?
Yeah.
Yani it's a lot of carbs, a lot of fats,
Yeah.
small amount. It's mean by Kuwaiti language, dwaga.
Yeah.
Small pieces.
Yeah, you have to basically be very moderate when you are
Yes.
eating, especially in Ramadan. But I think the main challenge, if you agree with me, is the dehydration.
Yes.
For a cardiovascular patient, it's very important that they stay hydrated. Given the long span of the time of fasting and the time of their medication, of course. What is your ideal schedule for patients with cardiovascular disease? Basically, how much water they should drink? What you mentioned some fruits and vegetables.
At least 10 cups per day. After iftar, they should drink at least 10 cups of glass of water. It means around 2 to 3 liters per day. Consume a lot of amount of vegetables. I'm insisted to eat suhoor. Some people they are telling I'm not eating suhoor. No, eating suhoor is very healthy, and drink plenty amounts, as I told, for water, and increase low fat dairy products. Also, it should be contained in suhoor. They give plenty amount of water and vegetables. I'm insisted about vegetables and fruits. Avoid salty and spicy and sweet because it make the person too thirsty, and also caffeinated products because caffeine containing thiophyllin. Thiophyllin is a diuretics, so it make dehydration.
But when it comes to caffeine,
Yeah.
I'm sure you heard about this. A lot of people say that caffeine actually could increase the heart rate. Is that true? Especially for
Yes, moderate consumption of caffeine is good for heart, but if it increase more than 4 cups per day, it could be harmful, increasing the heart rate, increasing the blood pressure. It could cause arrhythmia. Arrhythmia, it means palpitation or changing of heart rate and abnormal beats. Also make bladder irritability and an anxiety disorder. And by the way, anxiety is one of the risk factor of cardiovascular disease.
Yeah.
Yeah, there should be little consumption of caffeine during, especially during Ramadan.
So everything.
Also, sleep disturbance, caffeine making sleep disturbances.
Yeah.
Sleep disturbance also affects the heart,
Yeah.
affect our cardiovascular system because patient cannot sleep well. He will suffer from the arrhythmia. It's abnormal heartbeat. His blood pressure become elevated from lack of sleep because he will break his circadian rhythm, sleeping pattern. So, it should be avoided.
Exactly, and that will precipitate into anxiety and
Yes.
stress. Now, in terms of exercising, some people wish to exercise during Ramadan, especially the last hour of fasting, just before they're breaking their fast in the futur time. Again, if for a cardiovascular disease patient who's suffering from cardiovascular disease, what exercises that you recommend that they do and what schedule they follow?
Yeah,
Is
exercise.
it during? Is it during fasting, or is it you recommend that they do it after?
Yeah, exercise and fasting combination is very good for lipolysis and loss of fat. So it is important during Ramadan to exercise, because somebody, if he is athlete and he's regular exercise and he stop in Ramadan, he will lose 4 months. 4 months. He's not stopping if he stopped. So I'm advise a patient to exercise, but after futur, between futur and the suhoor, they can exercise. During the day, they can intermittent exercise, avoid exposure to sun because the dehydration also. When he's feeling dizzy or nauseous, he should stop. And also he's also to maintain salat al-Tarawih is very important. It's like exercise. So we advise the patient to intermittent exercise. If he will take 30 minutes exercise per day, he will not take the 30 minutes all together. He will 10 minutes, then relax it, take some rest, 10 minutes, 10 minutes, 10 minutes, like this. And also avoid vigorous exercise during Ramadan. Yeah, the most important healthy exercise during Ramadan, or even though all over the year, is brisk walking, swimming, and riding a bicycle. This is the healthy exercise. I'm also giving to my young generation to avoid going to the gym and taking the amino acids, and we saw a lot of catastrophe in this patient taking medication to unknown source. It is harmful to the heart.
Exactly.
This is by the way. Yeah.
It is very important for the patients the audience basically, who are patients, to understand the importance of exercising, and that is a part of a complete package, including the lifestyle changes you mentioned.
Yes.
One of the main challenges that I think you and I face in our clinic is that people who have cardiovascular issues and they smoke. So that's very, very, very challenging, especially in Ramadan.
Yes, Ramadan is a good chance for the people to quit smoking, really, because he almost non-smoke during 13 to 14 hours. So I'm giving them advice to quit these bad habits, and really it is harmful to their heart. One of the major risk factors for cardiovascular disease, hypertension, diabetes, and with hypertension and diabetes is smoking, leading for, unfortunately, death through myocardial infarction, stroke. Suppose he become stroke and hemiplegic, his life will change.
Exactly.
Yeah. So I'm insisted, and I want the patient to quit smoking. Really, smoking is not, especially chemicals. Some chemicals now we are seeing a lot of vape.
Yeah.
Yeah, this is chemical. This is not good. This is very dangerous than ordinary cigarettes.
It's actually more harmful.
Yes.
Than, and hopefully they be able to quit the whole thing.
Yeah, I wish also there is a law to stop smoking all over the world.
It has to be from the patient himself.
Yes,
but,
it should be.
Dr. Abdurrahman, thank you so much for being with us. And
Thank
we
you.
were so happy to have you with us. We couldn't cover everything, but that's all the time we have. Hopefully, we'll be able to have you
Inshallah.
again with us.
I wish for that.
And we wish you happy Ramadan.
Happy Ramadan to all.
Thank you very much.
Thank you.
And then we will hopefully see you again.
Inshallah.
Thank you so much.
You.
Dear viewers, we will have a short break and I'll be right back. Stay with us. During the holy month of Ramadan, many of us try to adjust their lifestyle into a better and healthier lifestyle. And one way people follow is switching to better healthy choices within their diet. Because diet plays a crucial role sustaining energy levels and ensuring overall well-being throughout the fasting period. Now, let's watch the next report for some dietary tips during Ramadan.
Good evening. If your treating physician is allowing you to fast during Ramadan, please take care about your food intake. Although there is no one magic food to improve your heart health, still we have evidence about the importance of some ingredients in your diet. First of all, limit the consumption of processed and fried food. It's full of trans and saturated fat. And instead of that, try to consume more omega-3. It's an essential fatty acids which is well known to be a heart-friendly ingredient and to reduce inflammation. We have different sources of omega-3. And the most famous one is the consumption of oily fish, like sardine, tuna, or salmon. Also, we have vegan sources, like the omega-3 and the healthy nuts, especially the unsalted walnut. Secondly, increase your intake of fruits and vegetables and try to use different colors. In addition of fibers, potassium, there is another important ingredient which is the antioxidants. We have different types of antioxidants like vitamin C, lycopene, selenium. It will help you to improve your heart health. Cooking method will really affect the antioxidants in your food. Taking the example of tomato, the lycopene, which is the red color in the tomato, will increase in case we will boil or cook the tomato. And in case of the capsicum, the vitamin C will really go down in case of cooking. Still, we need to consume both types of vegetables, cooked and raw. As a third point, think about adding unsalted raw nuts in your diet plan. It will give you plant-based protein, fibers, and healthy fat. Think about your weight. In case you have any extra weight, please start working on it with your dietitian. Keep yourself well hydrated. Stay healthy. May Allah accept your prayers and fasting.
Well, that's it for our show today. Hope you enjoyed it. Until we see you again, please stay safe and stay healthy.